I do not recommend the use of muscular violations. Hello everyone! Soon we will be celebrating Christmas and New Year. Today I'm gonna tell you what to do with holiday overeating and such symptoms as abdominal pain, dysphagia, diarrhea, as well as nausea and vomiting. First of all, I will analyze those symptoms or red flags that require emergency help. Then, in the end of this video, I will give you some tips and tricks when you will faced with holiday overeating. Abdominal pain is one of the most common complaints. Abdominal pain can occur not only with gastrointestinal diseases, but also with kidney disease, in women with diseases of the female genital organs and the beginning of the menstrual cycle, and even with the abdominal form of myocardial infarction. There are a lot of causes of abdominal pain, and for a timely diagnosis, it's necessary to consult the doctor in order to start treatment as soon as possible and to exclude or prevent the development of life-threatening conditions. Please do not rush to take painkillers. On the one hand, its action can smooth out the symptoms of an acute process, and you will think that the problem has been solved while the disease will progress. On the other hand, if you take analgesics and call an ambulance, it will be difficult for doctors to determine whether you have an acute surgical pathology. Ultimately, both situations are unfavorable for you, so you don't need to take painkillers right away, unless your doctor has advised you to do so. Dysphagia is difficulty in swallowing. The condition results from hindered or completely impossible passage of food, fluids, or both from the pharynx to the stomach. The pathological condition can result from either a motility disorder or a mechanical obstruction of the esophagus. A motility disorder could be caused by muscular violations and cranial neuropathies caused by diabetes, stroke, Parkinson's disease, systemic sclerosis, etc. A mechanical obstruction of the esophagus can be due to many reasons: esophageal web, a thin mucosal membrane that grows across the lumen, lower esophageal ring, a mucosal structure that causes a ring-like narrowing of the distal esophagus, extrinsic compression by enlarged or displaced organs, and even cancer. Patients with dysphagia should always have upper endoscopy, which is extremely important to rule out cancer. Any dysphagia is of concern, especially complete obstruction, drooling, and inability to swallow anything. It's a formidable symptom. All you can do to calm down and call for an emergency. Do not confuse dysphagia with globus sensation, a feeling of having a lump in the throat, which is not a swallowing disorder and occurs without impaired transport. Nausea is the unpleasant feeling of needing to vomit. Vomiting is the forceful expulsion of gastric contents caused by involuntary contraction of the abdominal muscula. It's worth pointing out that causes of nausea and vomiting may originate in the gastrointestinal tract or central nervous system, or may result from a number of systemic conditions. The most common causes of nausea and vomiting are following: gastroenteritis, an inflammation of the lining of the stomach and small intestines, drug or toxin ingestion, biliary dyskinesia. Other less prevalent causes are head injury, migraine, acute surgical pathology such as appendicitis and pancreatitis, and others. In female of childbearing age, we should always remember about pregnancy. If you have indomitable vomiting or decreased blood pressure, increased heart rate, and you saw blood in your vomit, then you should urgently call an ambulance. Many people consider an increased stool fluidity to be diarrhea. However, diarrhea is defined as stool weight more than 200 grams per day. I'm not talking about weighting your stool. Don't do that. Stool Stool weight can change depending on the amount of food consumption, but if the amount of your stool increased 2-3 times, if your stool become more liquid, it might be diarrhea. Acute watery diarrhea in outwardly healthy person is likely to be of infectious etiology, possibly tainted food, or an outbreak with the point sources involved. The appearance of blood, mucus, and pus in your stool is a dangerous symptom. Another findings raise suspicion of more serious etiology of diarrhea: fever, signs of dehydration, chronic diarrhea, weight loss. Especially dangerous is the condition with the cute name melena. It's a dark, solid body waste that contains blood as a result of bleeding in the intestines, as well as tumors, erosions, gastrointestinal ulcers, cirrhosis of the liver. Black stools can normally occur if you take certain medications, bismuth-containing drugs, activated charcoal, iron-containing drugs, or if you have eaten certain foods, blood sausage or steak with animal blood, beets, black currants, prunes, and sometimes tomatoes. If you have not taken previously listed products and drugs and you have black liquid stool, call for an emergency. I do not recommend the use of antidiarrheals in children and adults. Firstly, diarrhea is a symptom. It's necessary to find out and eliminate the cause and not to crush the symptom. Just imagine your body is trying to get rid of waste and you squeeze this noble impulse and all toxins, bacteria, bad food remain in your gut, from which they are absorbed into the bloodstream and poison you even more. Secondly, these drugs have many contraindications. In particular, they are prohibited for dysentery and other infectious diseases of the GI tract, for colitis, enterocolitis, for children under 6 years old, etc. If you don't know the cause of your diarrhea, taking an antidiarrheal medication, you could harm yourself. You may be surprised that all of the symptoms listed in this video may be due to overeating. If you realize you've consumed too much, then just stop eating. Take a non-eating break, move around, do exercise, go for a walk. You should not eat a large variety of foods that are not compatible with each other at one meal. Fruits should be eaten 1 hour before the main meal or 1.5–2 hours later. Drinking a lot of juices, tea, coffee with food makes it difficult for digestion. Don't try to eat everything at once. In my video about obesity, I've already told that feedback signals from the stomach come long after you have consumed too much. Remember this fact and try to eat consciously. If overeating is associated with abdominal pain, heaviness in the stomach, nausea, then you can take enzymes to improve digestion, such as pancreatine or pancrelipase. Abdominal pain is often caused by increased gas formation or bloating. In this case, dill tincture or simeticone-containing drugs can help you. Dill water and homeopathic gripe water are great for treating bloating and abdominal pain in children. If the pain is mild and spastic in nature, pain appears and disappears. An antispasmodic medicine, for example, dotaverine or papaverine, can relieve your condition. In case of nausea, you can sip lemon water, chew a ginger root, or inhale pine essential oils. I always have small inhalers with eucalyptus and pine oil in my bag. Treatment of nausea, vomiting, and diarrhea is targeted at the causative disorder. Rehydration is very important. Oral rehydration solutions should contain complex carbohydrate or 2% glucose and 50 to 90 millimole per liter of sodium. Sports drinks, sodas, juices, and similar drinks do not meet these criteria and should not be used. They generally have too little sodium and too much carbohydrate to take advantage of sodium-glucose co-transport. Moreover, these drinks can cause additional fluid loss. Oral rehydration solutions such as rehydrol and colloidal trace minerals and electrolytes are effective in patients with dehydration, regardless of age, cause, or type of electrolyte imbalance. Of course, if their kidneys are functioning adequately. My main piece of advice for you: don't waste time on self-medication if you are not sure you can solve a health problem. If this video was useful for you, hit the like, cause when I see your reactions, it inspires me to make more videos. Share this episode with your friends and subscribe to my channel. Writing scripts on medical topics is quite energy intensive. I would be grateful for your support. Take care of your body and mind. See you.